Assalamu alaikum, everybody. My name is Dr. Rafiq Dar. I'm basically a neuroscientist. First of all, let me congratulate Dr. Hasib Anwar Saab, Chairman, Department of Physiology, and Dr. Ghulam Hussain and his team for organizing a very wonderful uh, international conference on brain and biomedicines. And I really appreciate because Dr. Hasib and Dr. Ghulam Hussain always doing a great job for the mental health because mental health is a kind of very challenging health in this era, and sometimes I am scared that um, mental health is becoming a kind of pandemic, due to the socio-economic and malnutrition things. And so this is a great step indeed by the Department of Physiology, Government College University, Faisalabad. I really appreciate. I'm really honored to give a talk on this international conference. I was really okay to okay to give talk in person, but due to certain projects, I was not in Pakistan. So uh, please accept my apologies, and I am trying to give you an online session. So thank you very much again, Dr. Ghulam Hussain, for inviting me. So for this conference, my talk is managing mental health and nutritional psychology model. So I will be focusing on a nutritional approach, how you can manage your mental health. So, in the outline, I will be describing a kind of background of nutritional psychology, and then I will be moving forward how nutrition and mental health is important. Then I will be sharing you a very, very innovative approach. This is called 3Ws model of nutrition. And this is not an ideal kind of thing, but near to a very ideal and productive approach in managing mental health. So my talk will be focusing on these three important things. So first of all, let me introduce what is nutritional psychology is. Basically, nutritional psychology is a branch of psychology that deals how our cognitive choices, how our decision meals influence our overall health and especially mental health. So that means how our eating behaviors are influencing our mental health. Not only what we are eating, but how we are eating, at what time we are eating, how much we are eating. So our how our eating behaviors are linked to our mental health. This is called the nutritional psychology. Actually, this branch is not very kind of old one, but it's a very an emerging concept. If you look in the Google and go to search about nutritional psychology, you will not find much more about nutrition psychology, but just few people are working on that. One of them is Dr. Mafio. She is founder of actually nutrition psychology. She is working as professor in John F. Kennedy University, and the other professor is Dr. Hull. She is also co-founder of nutritional psychology, and I have already started working on this model, this approach as well. And I was able to introduce a model. Later on, I will share you this concept, this theory and model. So on nutritional psychology, this is called 3Ws model of nutritional psychology. And when I started working on nutritional psychology, and in parallel, when I was looking something on Google in nutritional psychology, I was able to find these two professors who are also working on these concept, how our eating behaviors are influencing our mental health and overall health. So I came up with a very important model on nutritional psychology. This is called 3W's model of nutritional psychology. Later on, I will be going to introduce. This is my brief introduction indeed. Basically, I'm a neuropsychologist and I have doctorate in neuropsychology from University of Strasbourg. And before I have master in neuropsychology from three European universities. In addition to that, I have few certifications from Singapore, Canada, America, and I'm also the founder of this theory, this model, 3W's model of nutrition psychology. Later on, I will be going to explain this model, how this model can be more beneficial in managing our mental health. So first of all, let me focus some light on, does food affect mental health? Is it really? Yes. In many different ways, the food is going to affect your mental health. There is a lot of evidence available in the literature that indicates food is directly or indirectly affecting our mental health. So suppose I have this triangle that is focusing on mental health and food. Suppose there is a food in the center. So food can affect biologically. Biologically mean if you are eating something that can make certain neurochemicals, even chemicals that are very good for mental health. Suppose that means food can directly affect biology. And if your biology is affecting your thinking, your psychology is also affecting. And then if your psychology is being affected, so your mental health is affected. For example, if I am in the stress and I usually remain in stress, so I can get mental health issues like depression, anxiety. So psychology is linked with the mental health, and if you are mentally sick, your biology can affect. So there is in between, one of the factor is the food. So sometimes food is directly affecting you psychologically. Suppose if you are not liking something to eat, you will not be feeling comfortable in eating this kind of thing. So sometimes food is also affecting you psychologically, sometimes direct mental health issues. Suppose if you are not eating something that is really important in synthesizing neurotransmitter called serotonin, so that means that food is directly linked with the depression. So if you are not having a proper serotonin in your body, you will not be okay, you will be depressed. So this is a very beautiful triangle that justifies that food is really, really important for your mental health. So, so how should we go for the eating? What kind of behavior we should have in eating? So this is really important. Again, if you look at this slide, there is a cell in the brain. You know, this is the neuron, and in neuron there are synthesis of certain chemicals like neurotransmitter, and neurotransmitter are directly linked with your mental health. For example, serotonin, if I talk about the key important neurotransmitters that are involved in mental health, this is serotonin, dopamine, endorphin, acetylcholine, GABA. These are the very important neurotransmitter, and the precursors for these neurotransmitters are the food items what you are eating indeed. Suppose serotonin is synthesized by the tryptophan amino acids. That means if you are not taking a protein that contains tryptophan, you will be having a deficiency of the serotonin and you will be not be okay mentally, because deficiency of serotonin leads to depression. And in the same dopamine, if you have deficiency in the dopamine, you may not be feeling in pleasure and the things. And endorphin, these are the kind of tranquilizing kind of neurotransmitters. These are the natural painkiller in your body. So if you are having a very less amount of endorphins, that means you will be feeling more panic. So there are certain foods that are able to synthesize all these neurotransmitters. And keep in mind, these neurotransmitters should be in balance. Even if they are low, they are dangerous. And if they are even high, they are also dangerous. So you need to keep in the balance. And again, food is important because food serve as the raw material in synthesizing all these neurotransmitters. So the balance is the key, so there are different kind of concept, especially in our culture. Suppose if we say something is really important, we make it final. Yes, this is very important. Like if we say almonds are really good. No, almonds are really good, mutton is really good, water is really good. But keep in mind, every food is not good for every person. This is my approach. This is my theory. So, what can be the effective approach? Let me give you a 3Ws model of nutrition. So, 3Ws model of nutrition is that the old concept is we are focusing only what we eat. No, let me add two more W's in that. Who eats actually? Suppose if I am eating more sugar, might be this is helpful for me. But if someone is having the same level of sugar, that will be dangerous for him or her. So that means who eats is also matter. And the third W, let me add you, this is when you eat. When mean which time of the day you are eating, which season you are having. So this is the concept of when. What are you taking after what? So these are the when concept. So while you are having a food, please consider 3Ws. What mean what you are eating and who you are. Suppose if I am eating tomatoes and I have kidney stones, that will be not good for me. That means because the tomatoes carrying more calcium, phosphorus, these are not good for the kidney stones. Their size will be increased. So I should avoid that. And for some other person, maybe these things will be good. So you need to focus on the who as well and when as well, because timing is also important. Let me explain one by one. Suppose let me introduce the concept of what we eat. Basically, we have very important things what we eat, like carbohydrates, proteins, lipids, vitamins, minerals, and water. So these are the components. These are the very important components of a nutrition. They have effect on our mental health. So what we eat, that will really affect on your mental health. Suppose if you are having carbohydrates, high level of carbohydrates, that may lead to, because high level of carbohydrates mean they are sugars. So if you are having a high level of carbohydrates, they may lead to depression, anxiety, even addiction. Sugar is addiction, because when you take high level of sugar, that they activate your reward system, and you got addicted to that. So in the same way, your learning and memory is affected if you are having high level of sugar. But if you are in the moderate level of sugar, that can be good. But again, the same level of sugar may be bad for other person, or may be good for the other person. So it depends who is eating actually. Suppose let me give you example. If there is a labor, they're physically working hard all the day, and if they are having even more sugar, this is good for them, no problem, because they will burn this sugar, they will burn these calories, there is no problem. But if my lifestyle is spending all the day in my office, so even small quantities of sugar will matter for me as well. So this is the whole concept. And again, if I have set an issue, suppose if there is a person who is ADHD, who has autism, even a very small amount of sugar will be disaster for them, because they will be more hyperactive. So it depends who is eating as well, what you are eating, who is eating actually, this is also, and when you are eating, this is also important. So these are the carbohydrates. In the same way, uh, proteins are important, like If you are having protein that are going to synthesize certain neurotransmitter in your brain, like serotonin, this is the chemical structure of the serotonin. So if you are not taking certain foods which are good at tryptophan, because tryptophan is an amino acid that is mostly involved in synthesizing the serotonin. So if you are eating certain proteins which are lacking tryptophan, you will be having less serotonin, and if you are having less serotonin, obviously you will be not feeling good. So in the same way, lipids are really important. Like almost almost your 50% of the gray matter in the brain is made up of fats. So certain people say, no, 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 no. This food contains high iron. Yes, if you are adult, might be you need less lipids, but if you are a child, because when your brain is developing, at that moment you need a high level of. So this is the who concept. Yes, you're taking lipids, but for the adults, lipid should be less, and for the children, lipid should be high, because you need to develop your brain for your children. You need more lipids to entertain. So this is the concept at who should eat what. So this is really important. And again, vitamins are important. At certain time, you need more vitamins. And again, for example, here is a vitamin C in students is really important, because the students are really hardworking, they are more stressed, and they need more vitamin C. Suppose if you are having a very good job, if you are living in a certain area where there is a lot of fruits which have high vitamin C, suppose like if you are living in a kind of Sargoda city in Pakistan, where you have a plenty of oranges, and your staple food is having kind of uh, such vegetables which are really good at vitamin C, like cabbage, bell pepper. If you are routinely taking such kind of things, you will be having more vitamin C in your body, and you will be feeling relaxed, obviously. But if you are a student in a very kind of competitive environment, and you need to lead, so you will be feeling more stress, and you need more vitamin C. So such people need more vitamin C. Other group may not be looking for such dose of the vitamin C. So this is important. Again, vitamin E is really important, especially if you are going through a very neurodegenerative diseases like Alzheimer disease, because they give vitamin E gives you the cognitive performance during the aging. So vitamin C for such people in the older age is really good. So might be vitamin E should not be so important in the early ages as well. So in the same way, water is also important. Like suppose if you are having a kid less than 6 months, there is no need to water. Water is lethal in such kind of age span. And if you are going older, you need more water. You need more water indeed. So depend who is taking again who. So you must consider three W's as well. So in the same way, when the concept of when mean, you need to understand a kind of circadian system in your body if you want to understand the timing concept of the meal or food. And your every behavior is regulated by an internal clock that is present in your brain. And that means your every behavior is peak at one time and down at another time of the day. For example, let me give you an example. Like there is a sleep hormone, this is melatonin, and this is going to be peak in the midnight, like around 2 2 a.m. early in the morning. That means at that time you are having a deep sleep, and melatonin starts secreting around 9 o'clock in the night. So suppose if I am going to drink a cup of coffee at 9 o'clock or 8:30 or even 8, this coffee will disturb my melatonin and I will not be going to sleep. My sleep will be shifted to other time because I'm going to disturb my clock through the caffeine, because caffeine and melatonin are like that. So I should have a cup of coffee early in the morning that will complement my cognition. That will that will be okay for me. So the same cup of coffee if I'm taking in the evening, that will not be good enough as early in the morning. So this is the timing concept basically. So if you are considering when this is really important, like there is a very important article here: meal timing regulate the human circadian system. So timing is really important. And even what you are eating at what, suppose if I'm going to prepare any kind of exam, and I want to engage myself in the mental activity, and I have just did my lunch, and I'm going to uh, engage myself in the mental activity, that will not be good. This timing is not good because I have taken meal, so my more blood will rush into the stomach and less blood will be to the brain. So with less blood in the brain, if I am doing any mental activity that will damage your brain cells. So this is the timing concept. So the students who are who are going who are in routine studying after meal, their cognitive abilities got decline. Every day if they're going to study after the meal, their cognition is going to decline. They will having a learning issue, memory issue, concentration issue, focus. So timing is really important. So you should not go for the kind of study just after the meal. So you should take 2 to 3 hours, because it depends on the meal what kind of. If you are having heavy meal, you should wait around 2 to 2:30, 2 to 3 hours for the study. Or if you can have a light meal, you can wait for 1 hour, it's okay. So it depends on the type of the meal you are taking. So timing is very important. So again, if you are having going to have a breakfast, what kind of things you should eat? Suppose if you are taking high sugary breakfast in the early in the morning, you are having more chances to gain the weight, because your blood sugar is low in the early in the morning, your insulin is low. So if you are having heavy sugary breakfast, your sugar will spike and your insulin will also spike. What will happen? Your insulin will convert your sugar level, and when sugar level get down, you will feel more craving. So all the day you will be feeling like that. You will be again and again eating, and if you are put your going to put yourself on the sugar, you will got addicted to sugar. You will be liking more sugar indeed. So that will be the vicious cycle indeed. So starting your breakfast with sugary meal, this is not good for your health. So taking sugar early in the morning, this is not good for you. So you should go for the kind of, yes, you need a sugar, but you should go for the sugar in the complex form, like in the starch, in the like kind of wheat, like wheat flour. So all the day your meal should be digesting, and that will be releasing certain sugars to prolong your day. So you should not go for the simple sugar early in the morning. So like simple sugar mean cake, pastries, raw sugar in the tea, coffee. So these are not good. Any desserts, you mean any external sugar from outside, but you should go for the natural sugars in the form of fruits and vegetables. So this is the concept. And again, who eats? Again, this is really important. Who is going to eat? Suppose, for example, let me give you an example of water consumption in children less than 6 months. So, having water for children, kids who are less than 6 months is not good. And we know that water is really, really important. We have the concept, but at this time, water is not good. And for this age, caffeine is not good. But for my age, adult age, caffeine is good. Again, caffeine is not good. Coffee is not good in the late age, because your brain is more sensitive in early age as well as in the late ages. Because early age, your brain is very soft, your brain is developing. So if you are having a coffee, a nicotine, any other stimulant, this is not be good. But for the adults, coffee is okay, but again in the older age, coffee is not okay. So let me give you the example of this coffee. Even timing, if I explain you the coffee timing, like if you are having early in the morning, coffee is really fantastic. And if you are having coffee in the evening hours, this is not good, because that will disturb your melatonin level, and melatonin level is going to disturb, that will disturb your sleep. So you know how sleep is important for mental health. This is really, really important. So again, let me give you an again example. If your children, who I'm explaining actually, who, if a children is having with autism or ADHD, high sugar things are lethal for them, because they are already active, and if you are giving very raw sugar, giving more calories, they will be more hyperactive. This is not good for them. Yes, if there is a labor class who is working physically harder, they need a kind of sugars to maintain their calories, because they will burn, they have no issue. So again, certain things like the potential role of yes, probiotics things for the autism spectrum disorder children are really good, because children with the autism, they are having routine infection and they kill their useful bacteria, so they are needing probiotics in routine. So if you give them probiotics, they are really good for them. Again, foods to avoid by the male, certain foods should be avoided by the, I'm discussing who. For example, a male is with the testosterone hormone, because if a male is lacking testosterone hormone, maybe he's not considered as male, might be. Testosterone is really impact maleness. There are certain foods that is not good for the maleness. For example, there are certain vegetables which contain phytoestrogens. Phytoestrogen is like a estrogen hormone in the female. So if a male is having such kind of vegetables, like you know leguminous food which contain legumes like peas, peas and mint also contain phytoestrogen. If you are having a lot of peas, mint and things like that, even soya is containing phytoestrogen. So if you are having routine things on daily basis, there will be more phytoestrogen, and your testosterone level will be disturbed, and you will be having, such males are having feminine characteristics sometimes. So such things should be avoided by the female, they are not good for them. In the same way, female should avoid certain things like beef is really, really lethal for the female, because beef contains certain things which 70% decrease fertility. So for females, beef is not really good. So in the same way, I have explained this whole model in my review article. This is what, when, and for whom model of nutrition. It's a really, really health management approach. If you can go through this article, you will be having more concept about this nutritional psychology approach. And again, Hippocrates had said uh, uh, very important things like, let food be the medicine and medicine be the food. So in future, only nutrition will manage the patients, because food is having a lot of things to manage your mental health as well as physical health. So in the lighter note, as I was explaining three W's model, but let me introduce a fourth W as well. So if I say sometime, it is not only matter what you eat, but it also matter when and with whom you eat. This is also really important. So your company also matter. This is the fourth W in a very lighter note. And again, at the end, I must say, you are actually what you absorb. So very simple. What you absorb, that reflect your personality indeed. So again, I'm really thank you for listening me, and I really congratulate Dr. Hasib Anwar Saab and Dr. Ghulam Hussain for organizing such a wonderful event. I again apologize not coming in person due to certain assignments in abroad. So inshallah, see you soon, and many best wishes for your event. Thank you so much, and see you again.